I don't think I need the mic either with us here at a couple of tables. So my name is Dr. Jeremy Brown. I'm the Medical Director and Executive Director for Hospice of Lubbock. I just celebrated actually my 10-year anniversary at Hospice. November 1st of 2010 is when I started as the Medical Director at Hospice of Lubbock. So I've been doing this full-time in some capacity for the last 10 years. I always like to start in these kinds of talks explaining what hospice is. I never know who my audience is. I never know what experience people have, and so I always think it's important to at least give my perspective on what I think hospice is, and hopefully that matches yours, and if it doesn't, then we can certainly talk about that. I don't mind interrupting. We'll keep this very informal, so if you have a question, if something comes up, please feel free to ask. I'll tell you anything that I know, and I'll make up anything that I don't. So we should be all right. So when we talk about hospice, we in the hospice world tend to define it based on Medicare benefits. It has been recognized as a Medicare benefit since 1987. It's been around longer than that, but that's when it was formally recognized. And so at least, and when I'm speaking, I'll be speaking about Hospice of Lubbock. There are probably 16 different hospices or so in this area. And I can't speak to how the other 15 do business. I can tell you that we are all regulated by the government the same, but it's just like whether you buy a Hyundai or a Lexus, everybody's going to have a little bit different accessories into how they manage their business. But the guidelines and how we care for people really do come from Medicare. So as far as hospice goes, it means that you have been given a terminal diagnosis. It means that your life expectancy is 6 months or less if the disease that you have been diagnosed with runs its normal course. And so where that gets to be problematic is that if you have a disease like Alzheimer's, that is a disease of years, not days or weeks or months. And so a diagnosis of Alzheimer's may start 10 or 15 years before you get to a point that you've declined where you become hospice appropriate and where that death would not be unexpected in the next 6 months. So our length of stay for our hospice patients tends to be a little bit longer than that 6 months prognosis. However, if you're diagnosed with a stage 4 cancer that you choose not to seek treatment for, 6 months is probably a pretty good time frame as far as a life expectancy, whether it's pancreatic cancer, whether it's lung cancer. 6 months is a pretty reasonable average. So my role as the medical director for Hospice of Lubbock is then when we get a referral on a patient is to look at the medical record and say, what is the patient's disease and what is that prognosis as I can best guess given where they are in their trajectory. So if you're still driving and you've just been diagnosed with Alzheimer's, you're not going to be hospice appropriate. It's not until you've declined, our patients declined to a point where they've forgotten how to walk, they've forgotten how to talk, they've forgotten that they need to get up and go to the bathroom. Those are some of the very general criteria that we look at. If you have COPD or lung disease, we're looking at a patient who is dependent upon supplemental oxygen. They have a nasal cannula, they're wearing oxygen 24 hours a day. They can't get up and walk from here to the table without getting significantly short of breath. They may even have to stop and rest to get to that table because their lung disease is so bad. So that's my role as a medical director when we're looking at hospice. So hospice means that we ask the surprise question of physicians, of family members, of the patient themselves. Would you be surprised if you learned of this patient's death in the next 6 months? And if you can say no, we would not be surprised, then there's a good likelihood that that patient, your loved one, yourself, is appropriate for hospice care. Hospice is not an all or nothing, and so just because you come onto hospice one day doesn't mean that you can't come off of hospice in a few weeks. So let's say that you do have a cancer diagnosis and you come onto hospice because the treatment that you've had up until this point has failed, or you've chosen not to seek more treatment. And then let's say 6 weeks, 8 weeks come along, your oncologist calls you up and says, you know what, I just heard of a new trial down in San Antonio. It fits the type of cancer that you have. Not sure what the results of that trial may be, but if it's something that you're interested in, and it's something that you choose to do as a patient, then you just say, you know what, I'm going to step off of hospice. I'm going to step away from hospice, and I'm going to go seek this treatment and see what happens and whether that